welcome. I'm Peggy, and I hope that you will sit back and take the next few minutes to share with us, because together you and I have the chance to learn some things that are really life-saving and to improve the quality of everyone's life. And so we do have always the information and the phone number for you. And I am really privileged to have the young lady sitting here with me, and Dr. Neerja Arya, right?
Yes.
And she is with Secours Geriatric Care, Secours Hospital System. And she has quite a background. And she comes from Columbia Presbyterian Hospital in New York. She has Emory University, Dallas, Texas, and she just recently got off a plane from Sweden, where she attended an international medical conference. And I am just so thrilled to have you here. And you are, as young as you are, your specialty and the thing that really gives you meaning in your everyday life is helping senior citizens.
That's correct. That's my passion, and I enjoy and feel honored to take care of the elderly.
And more people in this country are living longer, and so the problems multiply. I wanted to say that she has had the University of School of Public Health, the residency, Louisiana State University Health Science Center. She has you are a member of the American College of Physicians, the American Geriatric Society, American Association of Physicians of Indian Origin, and the Greenville County Medical Society. So I wanted everybody to know that you come highly recommended.
Well, thank you.
And let's just start for a minute with, most of us are lay people, and we think that things happen, but that only happens to people when they get old. You know, you don't think young people have shingles or young people have a stroke. And we find, unfortunately, that is not always the case.
No, that's not. As for stroke is concerned, I've seen cases of people who've had stroke as babies, but stroke can happen in middle-aged people, even at a younger age, if someone has done some drugs or have bad lifestyle choices, or also just have some problems with blood vessels in their brain, some malformation. They can have a bleed in the brain, and that could be a hemorrhagic stroke. But typically, as one gets older, the risk of stroke does get increased. And there are two different types of strokes. One is hemorrhagic stroke, which is where there's a bleed in the brain. And the second type is ischemic stroke, where there's due to an infarct, meaning not enough blood flow to the brain. So then the brain will have sort of a brain heart attack. When you're having a heart attack with the heart, that there's not enough blood flow to the heart, and then the tissue, the muscles in the heart, you know, have an infarction. Same way with the brain. That could be called an ischemic stroke.
Okay, now let's back up a minute. You said when you talked about stroke, lifestyle, people, is somebody who does drugs, they're opening the door to the possibility of a stroke?
Yes, absolutely.
And I'm talking, you know, there are a lot of drugs that are prescribed by physicians, and you need to do what your doctor tells you and read the labels and all that. But people who do drugs, those are two different things.
That's correct. So when I'm referring to drugs, what I'm referring to is not the drugs necessarily that your physician has prescribed for you, but these are the illegal drugs, such as the big one that's notorious could be with cocaine. And the reason that happens is because cocaine can increase the blood pressure. It can cause some vasoconstriction, meaning the blood vessels can get very small and tight, and a host of other problems as well. And that can cause problems with stroke.
And you've seen very young people.
Yes, my time in New York, when I used to take care of more of stroke patients, I've seen quite a bit of that. As well as some of the herbals. A lot of people take ginkgo. That's actually shown an increase in bleeds in the brain, so it could cause problems with hemorrhagic strokes.
What
ginkgo? Ginkgo is a herbal medication that a lot of people take to help improve memory. And there have been cases of people having bleeds in the brain from ginkgo.
That's interesting, because most of us feel that when we get something from that it's safe, that we're not doing something that's like a medication.
Right. No, unfortunately, the over-the-counter herbals, complementary medicine, there's some benefit, but then there isn't. There are a lot of studies that show that some of them can be harmful. And the problem with the over-the-counter or complementary medicines, such as the herbals, is that they're not really regulated at the quality of the pill, so it's varied from company to company.
So you have to be wise and read about it and check it out.
True, and the other thing is they can also have interference with the drugs that the physician does prescribe as well. So, okay. And it's very important to be honest with your physician with all the medications you take that are prescribed and not prescribed, because those can have an effect with the medications that you are prescribed. And a lot of people don't tell that to their physicians. And it is important to tell your healthcare workers or providers about these medications as well.
Now, you have quite a background. It's even almost international. And you came here for a specific reason. You were, Bon Secours offered you, they wanted you here. And could you talk to us a little bit about the improvement in our medical situation locally in the upstate, because they are bringing in a variety of people with all kinds of additional knowledge and training.
Right. Bon Secours St. Francis Hospital is very committed to the community we live in, and especially the population of elders, and that's considered patients or people over the age of 65. So they had decided to start a geriatric department to try to help the elders in the community, because as one does get older, you may need some extra care and attention to specific areas that can get complicated, especially when patients start having memory loss, start falling. A lot of things people consider that as just a normal part of aging, but that's not necessarily the case. People feel that, oh, it's normal to just have normal, memory loss, but that's not true. If memory loss starts interfering with your daily living activities, that is considered abnormal. So that's just one of the host of things a geriatrician can take care of. So yes, we did start the new department back in July to help elders in the community, and especially in the line of stroke. Having a stroke, of course, is very bad, but actually what is even worse is what happens after the stroke. When you have strokes, that can interfere with how you can take care of yourself. It could put you at increased risk of having other medical complications such as depression, pneumonias, and also dementia as well.
So if somebody told me once, and I'm strictly a layperson, but if someone has a stroke, the more immediate the help that they get makes all the difference in the outcome. In other words, if somebody has a stroke, they need help now.
That's true. If you feel that you're having symptoms of a stroke, which could be difficulty speaking, difficulty swallowing, having some confusion, some sensory loss where you're not being able to feel certain parts of your body, or motor loss, meaning you can't move part of your body, or you feel just one part of your entire body is numb, all sorts of different things like that, but those are the main symptoms. It is important to immediately go to the emergency room and get evaluated. If it's a false alarm, that's okay, at least you've been checked, but it's better to be safe than sorry. The reason is we have new medications out there that if it is something, if your stroke is due to blockage, they can give some medication if you are a candidate to get rid of the blockage. Basically how a plumber will unclog a pipe, it's sort of the same thing.
Then you can go back to basically a normal life.
You can. Some people do. And if there's a bleed in the brain as well, if it's a hemorrhagic stroke, then you may need to have surgical intervention, or being monitored with proper medication, trying to control the blood pressure so it doesn't get worse. So it is important, if you do feel that you're having stroke-like symptoms, to call 911, get to the hospital as soon as possible.
And your passion is helping older people.
Yes.
And so are there things that we can do, all of us, as we get older? I mean, if somebody out there is 40 years old, what are some of the things that you recommend that they start trying to do so that the rest of their life, maybe they will avoid some of the things that we all fear? And of course, lifestyle plays into that. Diet, I want you to address that.
Absolutely.
Because we need to know what to do to be healthy and to help our families.
Definitely, lifestyle choices is the best thing, is preventative care, not necessarily just taking a pill, making sure that you have an active lifestyle, getting enough exercise, at least 3 days a week.
All right, now wait, back up right there, because somebody told me, I thought, oh, you just go out and take a walk. And somebody said to me, oh, that isn't exercise.
No, that is exercise. If you can at least get 20 minutes of cardiovascular exercise, meaning you raise your heart rate about 20 minutes at least a day. If you could, I think anything is better than nothing. Every bit helps. As long as you're out moving, that's fine. A lot of people can't walk, as you get older. If you could at least be in the pool, or at least you can still do exercises just sitting down if you're not able to walk. As long as you're doing something to stay active.
Keep moving,
Keep moving. And a lot of my patients who are in the hospital, they're not able to get out of bed, but just sitting in a chair, that takes energy. You're burning calories, you're being active, you're using your muscles. So what I would say is whatever you can do something. And start off small, because you're building your body. So you may not be able to be as active, but if you start at it, you could build up your ability to do more exercise.
And
so
don't
definitely
start out and try to be an athlete overnight.
No.
Start gently and work up a little at a time.
Yes, I used to live in Chicago, and after snowstorms they would see a huge rise in heart attacks, because people all of a sudden start shoveling snow, and that's a very high aerobic activity, and so their body wasn't used to it. So it is important to get checked out by your physician if you're older, or have some medical problems, to make sure that whatever activity you're doing is safe. And a lot of gyms do actually require, if you have certain risk factors, to be evaluated by a physician before you get into a very active program. But something low impact like walking, I think for the general population should be fine.
It's the best thing we can do.
Definitely, definitely.
Yeah. Okay. Now we're gonna take a quick break, and when we come back, your department you help people with diet changes and all kinds of things. It isn't just exercise, but one thing we all need to do then is to keep active.
That's correct.
Okay, and maybe housework just doesn't do it. We'll be right back.